We're joined once more by former Senate Majority Leader and now Bloomberg News contributor Tom Daschle to talk about the future of health care reform, and he has been speaking with us all morning long from our Washington studio. I'm also joined again by my Bloomberg colleague Peter Cook, who is usually in Washington but here with us this week in New York, and a great pleasure to have you with us this whole week. Okay, Senator, I wanted to get to the idea or the topic of costs, not just how much it will cost to put health care reform together, but definitively, can you say that these changes will actually reduce costs for Americans?
I think it really depends, Betty, on just what we're talking about. Obviously, the more we can put infrastructural change in place, payment reform, having some sort of a super MedPAC or an organization that will be delegated with the responsibility. There's a very important key element here. You've got to be able to assure that somebody has the authority to make the tough decisions to reduce the costs. But payment reform is critical, prevention is critical, real changes in the infrastructure so we reduce the costs with regard to administration is critical. We can do it, but somebody has to make sure that these policy options and decisions are implemented.
Senator, it's Peter Cook. A lot of your fellow Democrats in Congress say it should be members of Congress who have to make those tough calls. Right now, they are very actively involved in deciding those reimbursement rates. This super MedPAC idea, essentially, is Congress going to be passing the buck on that?
Well, I don't think it's passing the buck. You know, the Federal Reserve System has worked pretty well, Peter, over the years in taking monetary policy and making the tough decisions we've had to. We don't always agree, of course, but nonetheless, they have that authority, and it's worked well. Somebody has to do it. Congress doesn't really have the institutional capacity, year in and year out, month in and month out, to make the administrative and managerial decisions, to tear down the stovepipes that exist today in federal programs especially. Somebody's got to be able to do that. Nobody has the authority to do that now, and I'm very hopeful that Congress will delegate some of this responsibility. It's the only way, in my view, we're going to get this job done.
Senator, we've been talking a lot about how to pay for this. A new idea that has come out in the last little bit from Senator Schumer, this idea about taxing health insurers directly. What do you make of that idea? Is that a more palatable way of targeting the benefits that Americans receive right now that aren't being taxed?
Well, it appears in talking with some of my former colleagues that they believe that is a little more palatable. I think that the insurance companies, once they start developing the campaign and opposition, they'll probably question whether or not it's more politically palatable. As I said earlier, there really isn't a palatable way with which to raise revenue. Some have suggested now putting a limit on the business deduction for health, and that might be more palatable, but we'll see in the next couple of weeks which of all of these difficult options members of Congress will choose.
Senator, we've only got less than a minute here, so I have to ask you just your final thoughts on this. If the president cannot get this passed, has he bet too much of his presidency on this?
Well, I think ultimately something will pass, Betty. I think it's too early to know just how comprehensive and how far-reaching it's going to be. But clearly, the president has put a lot of his own credibility and standing on this issue. Something has to be done, or he's likely to pay a pretty high political price. That's why I think he's committed to getting it done, and will stay with it until it does happen.
So either way, it looks as if we were looking towards some sort of reform in the health care system. So. Okay, Senator Daschle, Tom Daschle, thank you so much for joining us. He is our new Bloomberg News contributor. And, of course, Peter, great to have you with me during this whole time.